This is Agriculture Today, and I'm Shelby Varner with the K-State Radio Network. Glynn Tonsor, K-State livestock economist, begins today's show as he discusses the current cattle market and also provides a rundown of the meat demand monitor for September. Kansas Farm Management Association's Chelsea Plummer and Marshall County Extension Agent Susie Latta keep the show rolling with part of KFMA's recent podcast, where they talk about the SHICK and Medicare programs in Kansas. Ending the show for today is another segment of Faces in Agriculture, where we are joined by McCarty Family Farms' Ken McCarty. Ken explains his family's dairy operation and how they have expanded. That and more is coming up ahead. You're tuned in to Agriculture Today, and we start our Monday show with the cattle market update with K-State livestock economist Glynn Tonsor. Glynn, thanks for joining us today.
Oh, my pleasure. Thanks for having me on, Shelby.
Glynn, starting off our cattle market conversation, how is cash cattle looking?
Yeah, so this past week, kind of a mixed bag, depends on what weight class and so forth we talk about. So I'll just push through the numbers here. AMS called the fed cattle market through Thursday at 186. We looked at the feeder cattle market. It was quite varied by weight class. Dodge City was called $5 lower to $3 higher, depending on exactly which lot I might pull for you here. Two of them, for example, was a lighter weight lot weighing 485, sold for 311, and then a little bit heavier, weighing 631, both pretty large volume head. Those 631 pounders came in at 269. The lighter weight would be up, the heavier weight would be a little bit down on this past week. So again, kind of a mixed arena on the cash trade.
What about for futures?
Yeah, so I made note of the October contracts, which will be expiring soon here. Both live and feeder cattle were down about $3 through Thursday. So live cattle closed Thursday at 186, feeder cattle closed Thursday at 247. It is of note here that is, at least initially, kind of at odds with the pattern we have in box beef. So to round this out, box beef through Thursday was actually up $10 on the week for choice, and select was up about $3. I'm interjecting that because we're going to shift over to some beef demand stuff, and it's a nice segue for that. But there's a prospect that this coming week we'll have some demand pulled on cattle is the point. So I just gave a flat to down kind of summary on cash trade, and the board was down both for live and feeder cattle. But the wholesale level, so box beef, sent the signal that values were up this past week, and hopefully that spills over in the upcoming week as some additional support for cattle prices.
Talking about those demands, Glynn, your meat demand monitor for September has recently come out.
Yeah, so again, quick background. I know we have a regular following, but you never know if somebody's new on here, so I'll pause and just kind of give an overview. The MDM, so Meat Demand Monitor, is a project based at K-State. It's supported by the Beef and the Pork Checkoff. It's a large national survey of the U.S. public, been going on since February of 2020. So, it's now becoming a long-standing effort. And we collect data throughout the month, over 2,000 people. We kick out these, 3 to 4 page standard reports every month and these periodic deep dives. What you and I are referring to here is the latest base monthly report, which is for the month of September. So there's always this brief lag, right? We're talking about the most recently completed month. And some of the points of note this past month is in September, retail level. So think grocery store demand for at-home consumption. Demand was down for 7 of the 8 products we track. And that includes for ribeye steak and ground beef. So when I say it's down, it was down compared to August specifically. However, and I think this is worth harping on a little bit, is the trend was actually the opposite for food service. And I haven't said that much during 2024. So food service demand was up in September. And what I mean by that was willingness to pay for a meal away from home. And the dinner meals, when we track in the MDM, was actually up compared to August. So a meal that's centered where the main entree was a ribeye steak or a beef hamburger, and by the way, the same for the pork items and chicken breasts and other entrees, not just beef that we were tracking, was all up in September compared to August. And most months during 2024, I've been saying the opposite. I hope that continues. There's been a fair amount of pessimism by the U.S. public, and one of the things they do is limit their foot traffic through restaurants. That's going on, and that's kind of been my story throughout 2024, consistent with what MDM has been telling me. But September was a reversal of that, and I think it's really important to watch, as we go, we're now in October, as we go kind of complete 2024, do we see the food service channel starting to come back or not is going to be something that's important to watch.
And something else you track with the meat demand monitor, what's really important to residents when they're purchasing this protein?
Yeah, so we have something called the protein values. That's not a real novel name, but it's what we label them. And basically, I'm asking folks, of these 12 things, what are the 4 most important when you make a protein purchasing decision? What are the 4 least? And of course, the 4 you don't pick are kind of of intermediate importance. And what I want to impress on your listeners is regularly, month after month, and by the way, generation over generation, so this doesn't even differ between like Gen X versus millennials, for example, is taste and freshness are regularly chosen as the most important top 4 considerations, followed by price and safety. So those are fairly standard, not real controversial things. They're just core to the protein purchasing decision. Conversely, the items that I call social issues or production practice claim issues, so the use of hormones or antibiotics, claims around animal welfare, the ability to have, origin and traceability, and then environmental impact, those matter to some when they're making a protein purchasing decision, but it's the minority. So depending on which of those you ask me about, 10 to 20% of the public would say those are top considerations, where conversely, well over 2/3, if not 3/4 of the public would say things like taste, freshness, safety, and price are important. So relative importance differs a lot depending on the topic.
And for those top 4 really haven't changed through many of the years, correct?
No, they are quite robust. The only change we've seen, I call it of any substance, since we started the project in 2020, is the relative importance of price is higher today, and it was higher in 2023 than it was particularly during 2021. And a quick interjection for that, your listeners, Shelby, is people don't like to remember the 7, 8, maybe 10% inflation we had, depending on who you ask and how it was measured. But when we had that spike in inflation, a lot of households fell behind on buying power because their wages, right, weren't keeping up with the cost of living. And not surprisingly, one of the things we saw in the protein value series with that and subsequently since that is the importance price has grown because their buying power took a hit. So that one has changed a little bit over time. But your core point about the relative order of these 12 being pretty stable is spot on.
And Glenn, another thing that's tracked with your meat demand monitor, how often people are consuming these products from animals?
Yeah, so we ask people to, what I'd say is self-declare their diet. And it's a simple multiple choice question is, do you regularly consume products from animals, i.e. meat consumers like myself? Are they a flexitarian? So they eat meat, but they periodically purposely avoid meat in some meals. So think somebody that just purposely doesn't have, a meat on a Monday night or something like that. And vegan, vegetarian, or choose to not declare. So we let them opt out. We regularly see this, 68 to 75%, and it was 72% in September, that say they regularly consume animal products, which is meat here, and an additional 10 to 12% that are flexitarian. And it's really important to interject and add those up because flexitarians plus regular meat consumers comprise the customer base for the beef, pork, and chicken industry we're talking about here. When you do that, you're talking about well over 80, usually over 85% of the public falls into that combined bucket. I'm interjecting that because the vast majority of the U.S. public is a meat-consuming nation, and that has not changed. If anything, it has grown a little bit since we started tracking this in February of 2020. So yes, we do have vegan, vegetarian diets in the country. I see no problem with that in a country of choice. So that somebody can have that, choice. That's fine. But it's my job to kind of describe what the data patterns are. And the data pattern is persistent interest in meat being in the diet in the U.S.
And when we're talking about the meat demand monitor, you mentioned income and finances quite a bit. And how has the household finances been indicated changing?
One of the things we track every month, and we were doing this early in the pandemic, and it's just grown in importance, particularly after that inflation spike I alluded to earlier, Shelby, was how do you compare your finances now with a year ago? Are they the same? Are they better? Or are they worse? And I'm happy to report that September, we were up to 20% saying their finances have improved. Sometimes people ask me, why get excited about 20? Of course, I'd rather 80% of the public have improving finances, but everything's relative here. And earlier in 2024, I was reporting, 15, 16, 17% were saying their finances are improving. And when we have a country of 300 million people, and that's what I'm tracking here is a very large customer base, right, for our country, that increase of 3 or 4% saying their finances have improved is a big deal. It might sound small, but it is a big deal in this story. And what's really important to appreciate for our listeners who are obviously interested in the meat and livestock space is if you tell me your finances have improved in the last year, you are much more likely to tell me you had beef, pork, or chicken yesterday in one of your meals. So real narrowly for beef for a moment, is the 20% that told me their finances improved in September compared to September of 2023 had beef in 0.8 meals yesterday. So I know in these respondents, their breakfast, lunch, and dinner composition. So a little less than one meal of the 3.8 meals, right, on average, yesterday had beef in it if your finances have improved. Conversely, that's 0.66 or 0.67, so like 2/3 of a meal instead of 8/10 of a meal yesterday if your finances are the same or worse. So the frequency of including beef in your meals is much higher if your finances are improving. That's exactly what we would expect. It's just nice to confirm it here. It's not unique to beef, but it shows up on pork and chicken as well. And it's important to track this going forward because we don't know exactly where interest rates are in the inflation environment and so forth, but there are some reasons for optimism on that front. And if that spills over into ongoing improvement in consumer sentiment, like if more people tell me their finances are improving, I expect that to be a demand pull, right? Supportive for meat demand. And that would be a great thing for our listeners.
Glynn, if people want to look into your meat demand monitor some more, how can they do that?
Yeah, so everything about the meat demand monitor is based on our AgManager.info website. Consistent with it being funded by the Beef and Pork Checkoff, it's fully transparent. So the raw surveys, which aren't for the faint of heart, these are very detailed, long surveys, but we do post them for those that want to pull them up. The raw data is there. These 3 or 4 page monthly reports, which is what you and I just talked through for September, are there all the time. Everything you can find on AgManager.info under the broader meat demand section of that website.
Glynn, I appreciate you taking the time to join us today.
Oh, my pleasure. Thanks for having me on.
That was K-State livestock economist Glynn Tonsor. I will link the Meat Demand Monitor resource in today's show notes on agtoday.net. We're cutting to a short break now, but stick around because we have more for you up ahead. You're tuned in to Agriculture Today, and we continue our show with part of the Kansas Farm Management Association's podcast with Chelsea Plummer and Marshall County Extension Agent Susie Latta as they discuss SHICK and Medicare basics.
Can you explain a little bit what SHICK is, what it stands for, and what all services are provided through the program?
So all states in the United States have a program called SHIP, and that stands for the State Health Insurance Program. And so the SHIP program in Kansas is called SHICK, and SHICK stands for the Senior Health Insurance Counseling for Kansas. And this program is actually administered by the Kansas Department of Aging and Disability Services. And so what SHICK volunteers or partners do is we provide education about how to enroll and use Medicare Part A, B, C, and D, how supplemental or gap insurance works in coordination with Medicare, to make people aware of Medicare fraud and what to do if they become victims of fraud, as well as assistance in enrolling in the Medicare Savings Program and Extra Help Program for those Kansans that are struggling to pay for their Medicare premium.
Are these services stuff that is provided all year round, or are they available kind of more at certain times of the year?
The services are available all year round because people are always turning 65.
You mentioned what the name stands for, and so seniors is in the name. Is this the primary, I would assume, the primary group that SHICK serves, but are there other individuals that utilize this program, or is it mainly for people that are either turning 65 or over? I know there's people that are maybe on disability eligible for Medicare, so are they also able to use this service?
Sure. So SHICK serves everyone. Doesn't matter what your age is. But the majority of people that are Medicare eligible are at age 65. So therefore, it seems like that is the majority of people we serve. But like you said, it assists people with disabilities that are Medicare eligible on their 25th month of disability benefits. And then also people with end-stage renal disease also are Medicare eligible. So all circumstances are different. But in general, though, we provide assistance to caregivers of Medicare beneficiaries.
Just very basically, can you explain a little bit about what Medicare is?
Medicare is basically just federal health insurance for anyone age 65 and older, and some people under 65 with certain disabilities and conditions.
If someone turns 65, they've not started drawing Social Security yet, how can they either get information and or sign up for Medicare?
Okay, well, they can call Social Security and make a phone appointment, or they can go into the Social Security office, or they can go online to ssa.gov. I guess when a person is turning 65, if they're not already signed up for SSA, they should do that about 3 months prior to the month that they turn 65. For an example, if you turn 65 in October, then in July, you should be signing up for Medicare. So 3 months before the month that you turn 65, because Medicare goes into effect the first day of the month that they turn 65. So for example, if you turn 65 October 15th, Medicare goes into effect October 1st. If your birthday is October 1st, your Medicare goes into effect September 1st. So Medicare only starts on the first day of the month. So it's really suggested that you retire on the last day of the month so that you will have coverage on the first day of the month. Otherwise, you'll either end up being underinsured or overinsured. Now, if you're 65 and you're still employed by employer work group insurance that employs more than 20 people, then you don't need to sign up, until a couple of months prior to retirement. So usually always remember that 3-month rule. Most people go ahead and sign up for Part A of Medicare when they turn 65 because it's free. But you should not sign up for Part A of Medicare when you're still working if you have a high deductible health insurance plan and pay into an HSA, which is a health savings account. There are special IRS rules that affect having Medicare and paying into an HSA. So make sure you check with someone knowledgeable about Medicare, like an extension agent or a SHICK partner, and that knows and understands the rules, or maybe even to your tax advisor. If you're over the age of 65 and you're getting your insurance through an employer work group, that you make sure you check with your HR department to find out whether the drug coverage that you have through your employer work group is considered creditable, which means it's as good as or better than Medicare for 2025. Because if it is not considered creditable in 2025, then you'll be charged a penalty for the rest of your life for not having creditable drug coverage. So therefore, if you find yourself in that position, you really need to sign up for a drug plan between October 15th and December 7th of this year.
There's, these different parts of Medicare, Part B, Part D, Part C, Part A, and I think I covered all of them. But could you just explain briefly what these different components of Medicare are?
Sure. Part A of Medicare is considered otherwise hospital insurance. So if you go in for an inpatient hospital stay, it's Part A of Medicare that's going to pay for that. Part B of Medicare, which is often known as doctor insurance, is the most used, and that's where most Medicare claims come through, is Part B of Medicare. And Part B of Medicare is what everyone has to pay for the most part, unless you qualify for a low-income subsidy type plan. It pays for things like going to see the doctor, durable medical equipment, ambulance, blood work, and any kind of diagnostic testing. And then Part D of Medicare is the prescription drug plan. And this insurance is now privatized, but it's overseen by Medicare. And for 2025 in Kansas, there will be 15 different plans available for people to choose from. So this is where it gets a lot more complicated now. Now becomes the Part C. So I kind of went out of order there. The Part C basically puts together Part A, B, and D and a supplement into one package. It also might even provide dental or vision coverage that traditional Medicare does not provide. But Part C is what's known as Medicare Advantage plans. And they're privatized insurance that has no or low cost up front and then has deductibles, copays, coinsurance, and a max out-of-pocket that you pay after receiving a service. But the Medicare Advantage plan that you would choose to buy gets your Part B of Medicare premium. But basically you don't have Medicare Part A and B anymore if you have C, because that encompasses all of that. And the most important thing when purchasing a Medicare Advantage plan means you need to look at the network providers that your plan will cover. You want to make sure that the doctors and facilities that you use are in the network. And then don't forget about all the doctors like the radiologists, the anesthesiologists, and all those other professionals that provide services that you don't think about charging your insurance, because you need to make sure that they're covered too by your Medicare Advantage plan. And in Kansas, we're in a territory with Oklahoma. But there's no other guarantee how this insurances will pay in other states like Nebraska, Missouri, Colorado, and when you're on vacation and things like that. So you really need to be asking questions and finding out. I would say in Kansas, 98% of providers accept traditional Medicare. That'd be A and B of Medicare. If a provider accepts traditional Medicare, they will also accept your supplement. But with Medicare Advantage plans, there's probably only a 50 to 60% rate that a provider that you want to use will accept the Medicare Advantage plan that you choose to join. So you have to be really careful.
We see some different pieces of Medicare that it seems like are paid out of pocket or maybe withheld from the individual Social Security benefits. And I'm sure maybe this varies on the situation, but can you just help us understand a little bit how an individual pays for Medicare?
So Part A of Medicare is free for the majority of Americans. It's free if they paid in their 40 quarters or 10 years into Social Security throughout their lifetime. If not, it's available for purchase, but it costs, depending on how many quarters you would have locked in, so to say, anywhere from $278 up to even $505 a month per person. So sometimes people think they just take Part A of Medicare for granted, I guess, and says, oh, well, it's free. Well, it's because you paid in all those Social Security taxes over the year. So if you didn't do that, you would be paying a lot more for that. Part B is what costs. Right now for 2024, the base price is $174.70. As of the airing of this recording, they have not set the 2025 rates yet, but they assume that it's probably going to go up. It was announced recently that Social Security is going to get a 2.5% increase. So most of the time when you're getting Social Security is going to get an increase, the cost of the Medicare premium is going to go up as well. So in regards to that then, usually if you're receiving Social Security, then your Part B of Medicare premium is going to come right out of your Social Security check. But if you're not, then you have to pay it quarterly until you can get the easy pay set up so it'll start coming out monthly. They'll send you a bill or you go to mymedicare.gov and log in and you can pay online through that tool, app, website, however you want to call it. So otherwise, you'll get a bill in the mail from the Center for Medicare and Medicaid Services, and you can write them a check for your quarterly payment. In regard to Part C and D, they can also come out of your Social Security check. Most of the time, I encourage people just to pay the bill, write them a check. You can set up bank draft, but usually by the time the bank draft starts, there's change to a different plan, so I don't necessarily recommend that. It's very important that it does get paid.
Once again, that was Susie Latta and Chelsea Plummer. You can listen to this full podcast episode by following the link in today's show notes on agtoday.net, or you can find it for yourself by going to AgManager.info/KFMA. We're cutting to a short break now on Agriculture Today, but we'll be right back. You're tuned in to Agriculture Today, and we conclude our Monday show with another segment of Faces in Agriculture. And this week we're joined with Ken McCarty. Ken, thanks for joining us today.
Yeah, thank you for having me.
Ken, can you tell us a little bit about your involvement in agriculture?
Yeah, for sure. So my name is Ken McCarty, and I'm the youngest of the four McCarty brothers. We're a fourth-generation family dairy farm, born and raised in northeastern Pennsylvania. And my family and I moved to western Kansas in the late 90s. Grew up on a small dairy milking about 150 cows that was originally started by my great-grandfather in the early 1900s. My parents were looking for opportunity for my brothers and I to come back to the farm and for the potential to grow. That led us to Northwest Kansas through a lot of collaboration with the extension teams at Kansas State University, where I'm actually, and one of my brothers is an alumnus as well. We kind of put our roots down in Thomas County, and we've steadily grown since then. Today, we milk between 14 and 15,000 cows here in Kansas and another 4,000 cows in west central Ohio. Total herd size is about 36,000 cows, from calves to dry cows to milking animals. We run an on-farm milk processing plant and direct ship most of our products to Danone North America to be turned into a variety of different dairy products. And my particular role with our farm is I handle most of the activities within the processing plant. I handle all of our dairy cattle genetic strategies, do the majority of our sustainability work, and a lot of our animal welfare work as well.
And Ken, your farming operation also has a cool learning aspect to it for the public.
Yeah, that's right. So we kind of started, we've always, as a family and as a farm, been very open to tours and trying to bring people in and show them what we do as McCarty Family Farms, but also, what the dairy industry and the ag industry does in general. And a lot of that was really kind of driven by my mom. And we had when we built the dairy in Ohio, we really wanted to put a public face on our farm and kind of tell our story. We were new to the area and people didn't know who we were and they didn't know how we ran our farms. So we wanted to have an opportunity to tell our story. And that led to the creation of the Dairy Learning Center at MVP Dairy in Ohio. And ultimately, the success that we've had there and kind of the impact that we've been able to have led to the desire to have something similar here in Kansas. So as we've expanded the farm in the Rexford area, we really wanted to kind of duplicate the experience there. So we built what's called the Judy McCarty Dairy Learning Center, named in honor of our mom. And yeah, so thus far we have hosted over 3,000 people through there. We've only been open a few months. We're open to the general public, kind of to tell our story, to tell the story of the dairy industry in Kansas, the dairy industry within the U.S., why dairy foods are beneficial, why we strive to have high standards of animal welfare and environmental stewardship, how we manage our water sustainably, anything and everything that we do, we try to highlight and talk about within the Learning Center.
So, Ken, as you look forward in agriculture, what are you excited for?
Hey, the ag industry is a very exciting place to be. And what I'm looking forward to in the future is just the adoption of new technologies, things like artificial intelligence and machine learning, the ability to monitor and measure individual cow activity and transform that into actionable data points that help us milk a large number of cows, but milk them all on an individual basis, are the things that I'm really excited about.
Ken, if people are wanting to learn more information about McCarty Family Farms, how can they do that?
So I would strongly encourage people to follow us on TikTok, Facebook, go to our website. But most importantly, if you happen to be passing through Northwest Kansas, please stop in and visit us.
Ken, I appreciate you taking the time to join us today.
Absolutely. Thanks for having me.
That was Ken McCarty with McCarty Family Farms. I will put links in today's show notes on agtoday.net where you can learn more about this operation. That's all we have for you today on Agriculture Today, but we'll be back with more for you tomorrow.